Well, it's a pleasure being with you today to speak about sleep disorders. This is something I've worked with, as have most pulmonologists, for some time. It was about 20 years ago I particularly became interested in it and focused a large part of my practice on that, though I still do probably about half my practice, or just over half, is related to sleep disorders, and the rest is general pulmonology. But it's an area that has become of great interest in the last several years, just as people in general have become more interested in overall health and much more personalized sense of health care. There's so much information available on the internet, and frankly, because there's such prevalent conditions, and particularly things like sleep apnea and insomnia and just the general pressures of living that tend to impact on sleep and such. So there's a lot of material that we can talk about and that I'll try to cover fairly succinctly and leave time for questions. So what I will primarily focus on are these 6 areas. I'll give a brief overview of the physiology of sleep and a little bit about what it's all about. Talk about insomnia, which is the most common sleep disorder. I'll then just say a few words about restless legs and what's called periodic limb movement disorder, which is something of the nighttime version of restless legs, so to speak. We'll then speak about snoring and sleep apnea, which really have the most information to talk about. I'm sure many of you are familiar with that condition. Have a few words about sleep and the aging process and how things change as we get older. And then a big area that I'll just say a few words about, but it is really becoming increasingly recognized as a huge topic, is the impact of technology on sleep. So just to say, from the top, what is sleep? It is something of a mysterious aspect, just because it's something we're unconscious when it occurs, but it does comprise roughly a third of our lives. So it's obviously important, and we are more and more understanding some of the ways in which it is important in our overall health. But if we had to simplify what it is, we could say that it's a rapidly reversible state of reduced consciousness, motor activity, and metabolism that's rapidly reversible. Now, that may sound a little overly scientific and whatnot, but reality is that the brain in some stages of sleep is actually almost as active as it is during the wake. So it will go through several cycles and such, which I'll touch on. But we spend, like I say, roughly a third of our lives asleep. So it's an important aspect of overall living. We are learning more and more of the impact that healthy sleep has in well-being, and the impact that poor sleep has in a number of consequences. Those include the development of cardiovascular disease, memory issues, mood disorders, weight control, stroke, as well as just the impact of sleepiness on overall productivity and well-being during the day. And it can impact things like relationships and marriages and any number of things. There have been studies in the past to suggest that either too little sleep or too much sleep is associated with an increase in mortality. Now, in the last year or so, they've questioned the strength of some of those studies, but it does appear that if someone that really doesn't allow enough sleep or sleeping a tremendous number of hours a day, that does have some link to overall mortality, but the reasons for that are still relatively unclear. Now, on a typical night, we will go through several cycles of sleep, of different stages of sleep. It's generally what we would divide into 2 primary categories of REM or non-REM. REM standing for rapid eye movement, and that's typically when dreams occur, although they can occur in the non-REM stages. There's some important distinctions between those 2 stages of sleep, because REM sleep is the part of sleep I mentioned where the brain is highly active, and in fact it's not really clear as to all the reasons for that. But while your brain is very active, your your muscles, except for the muscles of respiration, are actually paralyzed. So I'm sure you probably all experienced that sometime if you're waking up from a nap, that you might wake up from a dream and feel like you can't move for a few seconds. That's known as sleep paralysis. That is actually a normal phenomenon, but it illustrates what's going on physiologically. And it's thought that that's kind of a protective mechanism. And there is a condition to where that protective paralysis may not occur. It's called REM behavior disorder, in which people act out their dreams and can actually injure themselves or a spouse or whatnot. Now, unfortunately, that's not a real common thing, but we do see it at various times. The non-REM sleep is what we would term more of the restorative sleep. That's the deeper sleep. Now, it's interesting that those two types of sleep, that non-REM sleep comprises most of the sleep in the first third to a half of the night. So if somebody's been sleep deprived and they fall asleep, they're typically going down into deep non-REM sleep. And it's that stage of sleep which, if you remember just having kids and all, is when things like night terrors will occur. And when they may wake up or scream, but they have no recollection the next morning of having done that, or when sleepwalking occurs. And that's because it occurs in that very deep stage of consciousness or of subconsciousness that people aren't aware of. Now, in contrast, if someone wakes up during REM sleep, which tends to be weighted more towards the latter third of the night, it's just like waking up from a dream, and you may have some very clear memory for a few seconds of what you were just dreaming about. And that's because the brain is very active, and you may not feel very sleepy at all when you first wake up from a dream. But then the memory of that may fade quickly. So it is interesting in that sleep apnea, which I'll touch on in a few minutes, tends to be most active or most likely to occur during that REM stage of sleep. So when someone comes to me and they report a history of having to wake up around 3 and 4 a.m., that's kind of the time they tend to wake up, or maybe wake up with a gasp. That often indicates that they're having sleep apnea, and it's occurring during that REM sleep, which is going to occur most often during the latter portion of the night. So, there's some physiology that can be very helpful in just the history when we talk to people about sleep disorders. Now, there is what's essentially the body clock of the brain, as a fancy name, the suprachiasmatic nucleus, is a group of cells really located right behind the eyes that regulates the timing of the sleep cycles. And these cells are exquisitely sensitive to light and are timed with light exposure. So, for instance, when somebody flies over several time zones, they experience the jet lag, which means essentially the shift in light. Their brain has not caught up to the light cycle of where they currently are, and that also can play havoc when somebody works night shift and such, because they're always kind of out of sync and off track, back on track and such. So it's an important thing to be aware of there, and there are some strategies that are used to help minimize that shift. But we also see it just in different periods of life. In teenagers and college students, there's a natural shift in their body clock to where they actually have great difficulty going to bed at what we would consider a normal time, and then they want to sleep late, and they may think, oh, well, they're just, don't want to get their homework done, but there's actually a physiology to that, and there has been a lot of press in recent years about later school times, just recognizing that that's just part of their physiology, and that's kind of another issue there, but there is reason for that. Now, conversely, in later years, that can be the reverse, to where you actually have a natural tendency to want to go to bed earlier and then wake up earlier in the morning. And so that, again, is normal. And there are some things we can talk about that can kind of help to keep that a little less pronounced, but it can create some issues when you've got several generations of one household and people going to bed at different times and whatnot. So how much sleep do we need? Well, the National Sleep Foundation a couple of years ago came out with a final recommendation. Really, 7 hours is really kind of the golden number. 7 to 9 is a reasonable range. But To average less than 7 hours, you really are getting insufficient sleep, which can have a cumulative effect in various ways. 100 years ago, I mean, we would tend to average closer to 9 hours, but as long as we're getting close to 7, we're doing okay. But that can take some work. I mean, it's not an easy thing for a lot of people to maintain, just given all the other pressures of life and whatnot. So, I mean, why do we get less sleep today? Well, in general, we live in a sleep-deprived culture, and sleep itself, in part because we just don't understand a lot about it, is kind of viewed as sort of expendable. I mean, you know, kind of the idea, well, you know, the macho man can work through it and not worry about it, and certainly that was the idea, you know, coming through medical school or professional school and all, that, you know, you kind of earn your stripes by going back on sleep, which, I mean, certainly at a point that's understandable and unavoidable, but there is an aspect that, you know, you can't get by, you can't avoid the need for sleep, and it's going to play itself out in one way or another, but there's just not been a whole lot of recognition in our culture to respect the need for sleep. And then when you dial into that all the technology and internet and Facebook, I mean, you really get an idea. It's just very easy to, you know, to really get by with minimal sleep. What are some of the other factors that impact sleep? Well, caffeine use obviously is a big deal. Now, there's an aspect about caffeine that many people don't realize, that it actually sits around longer in the body and has an effect beyond just a couple of hours. In fact, I mean, I've seen some studies that suggest the effect of it could last upwards to 15 hours or more, but at least 6 or 8 is not unreasonable. So if you struggle with insomnia, I mean, what I'll typically tell patients, at a minimum, avoid caffeine after 12 noon. Other things that impact sleep and a regular sleep schedule, I mean, certainly people that work, you know, night shifts or rotating shifts, or, you know, work an occasional night job here and there. Number of medications can affect sleep. Alcohol is a big one. A couple of words about alcohol. It is actually perhaps the most commonly self-prescribed sleep aid, because it will promote sleep when you take it at bedtime. It will induce that deeper non-REM sleep that we talked about. The problem is that after a couple of hours, it dissipates from the body, and there's almost creates sort of a mini withdrawal effect. So the net effect the remainder of the night is that the sleep quality will be worse, where people will tend to wake up in almost a fragmented sleep the remainder of the night and feel less well the next morning than they would have otherwise. On top of that, it can worsen obstructive sleep apnea on a given night. So they may, I mean, if they had sleep apnea that was untreated before, they may really have a bad case of it on that night. So just be aware of that. Generally, I'll advise people to avoid alcohol within, say, 3 to 4 hours at least before going to bed in general. Now, you know, I mean, people obviously might have had it to some degree, but just be aware that it does have an impact. Poor sleep hygiene. What I mean by this, there on your table you have a handout of several good sleep practices that are termed good sleep hygiene. I'll go through a few of those in a minute when I speak about insomnia. Stress and anxiety obviously have an impact on sleep for obvious reasons. And then there are a host of sleep disorders, and we'll touch on a couple of those today too. So what are some of the symptoms then of poor sleep? I mentioned insomnia. Basically the idea of you can't get to sleep when you want to, or you can't stay asleep once you get to sleep. I mean, those are common symptoms, where you wake up early in the morning and later or earlier than you want to, and can't get back to sleep. Snoring is a typical, very common symptom, as well as witness apneic spells or gasping for air at night. Complaints of kicking the legs at night, I'll talk about that in a minute. Memory loss is a common consequence of sleep disorders. Reduced concentration and irritability, as well as mood swings, can all indicate a problem with sleep. So let's talk a minute about insomnia. Now, insomnia, as I mentioned, is the most common sleep disorder. Roughly 30% of the population experiences insomnia in one way or another, and we're all basically subject to that at various times of stress or whatnot. And again, it can be a problem with either getting to sleep, staying asleep, or waking up excessively early, or a combination of those things. Now, in terms of some of the causes, I mean, I mentioned the stress, anxiety, depression, I mean, are very, very common causes. The sleep environment, in general, people will sleep better when the temperature is lower. Around 68 degrees is, if I had to say, an optimal for many folks. It's interesting that part of the physiology when we go to sleep is that our temperature gradually falls and actually kind of reaches a low point later in the night. But for the same reason you want to minimize exercise right before going to bed and increasing that body temperature, you want to keep the ambient temperature on the low side to help with sleep. Medication and caffeine, I mean, there's several medicines that can have stimulating effects or such as that. I mean, beta blockers being a common can cause nightmares in some folks. So, I mean, that's a common one there. Antihistamines of various types can cause problems. Now, what are some of the methods we typically use? Well, there are several over-the-counter medications, and these can be somewhat helpful. I mean, the common things people take was Benadryl or diphenhydramine, and that can have a little bit of an effect. It's not real pronounced. The downside with that and many of the over-the-counter ones, Tylenol PM basically has the same medication in it in addition to regular Tylenol. But they can leave you with a bit of a hangover effect the next morning, dry mouth and such, and so they're not great, though they're probably not that harmful per se, as long as you're not taking more than the prescribed amount. Unisom is doxylamine. I mean, that's a similar type medication, but again, not real strong. Now, melatonin is a little bit different. I mean, there's actual, over the counter is more in the herbal section. It is not really recommended as a sleep aid per se. Now, there is a role for it in sleep medicine, but its primary effect is to help regulate that body clock. So we'll use it perhaps when somebody is having issues with that, delayed sleep onset or such as that to help promote sleep earlier. But I mean, I certainly have a number of patients over the years that have used melatonin and say it's been helpful, and it's a very weak effect. So it's at the over-the-counter strength is probably not harmful, but it's not something I recommend as a routine sleep aid. Another common herbal concoction is the valerian root. Again, that's a very mild effect, if any. I mean, some people, convinced it helps a little bit. It's probably not harmful, but again, it's not something I'm going out and recommending people try. Now, as I mentioned about alcohol and the antihistamines, so you have to be real careful about that. Some of the other treatments, though, these sleep hygiene recommendations, if you got a more extensive list in front of you, but I'll just touch on a couple of them. In addition to eliminating caffeine, avoiding excessive napping during the day. Now, a short nap, maybe upwards of 20 minutes in the early part of the afternoon, is not bad and may actually be beneficial. The problem is when people start napping in the late afternoon, early evening for an hour or two, and then, not surprisingly, have difficulty getting to sleep. So just trying to manage that in an appropriate way is important. Now, avoiding bright lights in the evening. When people come to me with chronic insomnia, I'll often ask them about, how many bright lights and reading they do. I mean, with bright reading lamps and such. And another obvious big source are computer screens, and we'll talk about that a little bit too. But trying to minimize that bright light, because again, what that's doing is shifting that body clock forward to where you're just not normally wanting to fall asleep as quickly. Assessing your sleep environment, I mean, obviously things like, extraneous noises, dogs barking, comfortable mattress and bed, pillows, keeping the room relatively cool. And again, there are some more recommendations there in your handout. Now, there is a technique that's kind of one of the bedrock recommendations on management of chronic insomnia, and the medical term is stimulus control. And basically, it stems from the idea that the goal in your sleep is that you want to, or in treating insomnia, is you want to basically match up the time that you're asleep is that you're in bed and you're not asleep outside the bed, and you're also not in bed unable to sleep. So you want to just try to match up the time when you're in bed and that you're actually sleeping during those times and not some other combination of things. So the idea being that if you wake up and you just can't get back to sleep, don't sit there ruminating, pining, oh, I can't get to sleep, looking at the clock for an hour. Make yourself actually get up, go to another room outside the bedroom, do some reading, something not overly stimulating, until you finally just get drowsy and then go back to bed. I mean, there's not any real big trick to it per se. It does work. It takes a little bit of, just intentionality there and making yourself do it. And some people do it better than others. I mean, sometimes they may have to do it a couple of times a night. But that is considered one of the bedrock recommendations on management of chronic insomnia. Another technique just referenced down here, sleep restriction, is the idea that if you can't get to sleep or fall asleep, is actually delay your bedtime perhaps an hour, as long as you're giving yourself, say, at least 5 to 6 hours opportunity to be in bed, and so not delaying it too late, but that can actually help. Now, a more developed program of doing this over a period of time would fall under the category of cognitive behavioral therapy, or CBT. And that is something that's typically handled by clinical psychologists, and there are also some online programs that have come out. But basically, it's the idea of kind of almost rehab for sleep, where you go through a several-week program of learning these techniques and monitoring your sleep patterns and such, and trying to make them a habit. Now, I've had difficulty, sort of locating a good resource for that, and I know there's some psychologists in town that have done that, but that is sort of the textbook way to deal with chronic insomnia, is cognitive behavioral therapy. Now, that being said, there are a number of prescription sleep aids out there. In the last several years, there has been a move away from those. Over the last year and a half, the American Academy of Sleep Medicine or the American Sleep Association have come back around a little bit, just recognizing that they do have a role. That, for all we tell people about those other techniques, people are going to get frustrated, they're going to want sleep, so they're going to want a sleep aid. And so they've gone back and looked at all those medications, and they've loosened up a little bit on the use of them, recognizing, though, that with long-term chronic use, people, there can be a bit of a dependence on them, and people that take them, every night, and I will, constantly sort of tell people to sort of look back and let's try to get by with minimum use of that, even if it means, just using a sleep aid maybe 3 or 4 nights a week, and just maybe not having as great sleep the other nights, but just so they're not taking it every night. The dosage recommendations have also come down a little bit, particularly on Ambien, to where they're really not suggesting the higher doses that they did a few years ago, but they do have a role. So Ambien, Lunesta, and Sonata are very similar in makeup. Rosarum is actually related to melatonin. It is primarily, it's something you want to use in the early side of things. If somebody hasn't been on a lot of other medication for insomnia, it is not as powerful as some. It works less well if somebody's been on a whole lot of medications up to that point. But it's related to melatonin, and Belsomra is a little bit different mechanism. It is actually blocks the effect of a protein in the brain that if you've heard of the condition narcolepsy, there's a lack of this protein in the brain, and Belsomra sort of mimics the effect of having lack of that protein and then induces sleep. It also, I haven't frankly used it a whole lot. It's the newest of these agents. It's somewhat on the weaker side too. The ones I've tended to use are Ambien, Lunesta, and Sonata. Sonata is a very short-acting one. It's primarily for sleep onset or insomnia, or if somebody wakes up at 1 a.m., can't get back to sleep and wants to take something but not have a hangover effect the next morning, they can generally be safe in taking Sonata. Generally the effect of that's going to be gone in about 3 or 4 hours, but you still have to be careful with it. So moving on, take a couple of words here about restless legs and periodic limb movement disorder. Now, restless legs is a daytime phenomenon. It's very common. Roughly 10% of the population may experience it to some degree. It's thought to be related to some issue with iron metabolism in some way, and iron deficiency certainly can cause it, as well as a number of things like medications. See it in pregnancy, see it in people with kidney failure, all sorts of things, but most of the time it occurs just for unknown reasons. When we do a sleep study on someone in the sleep lab, what we will typically see, though, is the nighttime form of that. It's a little bit different, something called periodic limb movements. Well, they get a rhythmic jerking of their legs throughout the night. Now, much of it, we see it very commonly. Most of the time, it's not a problem that disrupts their sleep, but it can disrupt sleep and can create significant daytime sleepiness. And so there are a number of medications that are available for that. The first line, I mean, up front, you'd want to be sure there's not some obvious things like medications contributing, things like the antidepressants, Prozac, and SSRIs, things in those categories can be associated with the leg movements. But assuming that aren't the case, you want to make sure there's no obvious iron deficiency. The first line treatment is typically, it's a class of medications used to treat Parkinson's. You may have heard of the medications Requip and Mirapex. They're the two most commonly used. They are very effective. Sort of second line treatments, Klonopin is one that will often be used, and then going to Neurontin or gabapentin or some similar medications. In very severe cases, which I can't say I've even had maybe one or two people, they might even have to resort to chronic narcotics, but that's fortunately very, very rare. So, like I say, several comments I want to make about snoring and obstructive sleep apnea. I mean, these are two things that are just very, very common. Snoring is an extremely common symptom. Certainly not everybody that snores has sleep apnea, but the great majority of people that have sleep apnea snore. Now, snoring represents vibration of the soft tissues of the back of the nose and the throat. It's estimated that roughly 44% of males, 28% of females, age 30 to 60, do snore. Now, snoring can be made worse by obesity or anything that creates just an excessive tissue in the back of the throat and such, and large tonsils can contribute, as well as anything else that causes narrowing of the airway, as well as just anatomic issues, or maybe a large uvula, things of that nature. So, I mean, there are several things that can be done for just routine snoring. Weight loss. I mean, of course, I can say weight loss pretty much is a cure-all for a whole lot of things, but anyway, that, avoiding alcohol, because it will worsen snoring. Smoking, there may be some effect with smoking. It's not really a strong association there. Positional therapy. Snoring is going to be worse when you're on your back typically, and that's because the tongue falls back and further restricts the airway. Things very simple, such as positioning pillows to help keep you on your side, can be helpful. They actually make some even custom-made devices. I mean, it kind of looks like Buzz Lightyear, that you strap this wedge-shaped pillow on your back, and it keeps you on your side. I've recommended it to a couple patients, but I've seen one, but they just seemed a little overkill. So sort of an old school method, they'll say if you sew a pocket in the back of your sleep shirt and put a tennis ball in there, that can kind of keep you on your side more. External nasal dilators like Breathe Right strips can offer some benefit in snoring, so that's a simple thing to try. There are many oral appliances on the market, and I'll talk about those a little bit more in a few minutes, but there are several grades of these. I mean, there are many that may be helpful in snoring that range anywhere online from maybe $40 to $120. They can offer some benefit, and basically the two different ways that those devices help reduce snoring is, one, they clamp to the teeth and thrust the jaw forward slightly to keep the tongue from falling back and inducing snoring. Or they have a device that helps to fix the tongue to where it doesn't fall back. And there are several, I've had several people try some of the online, some of them, they seem satisfied with them. There are some more sophisticated devices, and I'll show you a couple examples in a minute, that are used to treat sleep apnea that certainly will work with snoring too, but they're just much more expensive, and that can be a limiting factor. There are various surgical procedures that can be done for snoring, typically by an ear, nose, and throat doctor. Now, oftentimes though, if an ENT is going to see somebody for snoring, they're going to want to make sure that they don't have sleep apnea, because that can impact what kind of procedure they might do or whether it's going to be worth doing at all. And you also want to be careful if sleep apnea is at all a consideration, because snoring is essentially acts as a red flag that sleep apnea might be present. And if somebody has something done surgically to eliminate their snoring, they then rob themselves of that indicator, and they can have silent sleep apnea, which can have other physiologic consequences even though they don't snore. There are also upper airway exercises that are thought to help. In fact, I've seen an article about how playing the didgeridoo, I haven't started selling those in the office, but supposedly they will help strengthen the airway muscles and minimize snoring. But as I mentioned, it's important to determine if snoring is an indicator for sleep apnea. So what sleep apnea is it's a very common condition, roughly 18 million or more than that. I'd say it may be, I saw something last night, closer to maybe 25 million folks have sleep apnea. It basically is characterized by either a partial or complete blockage of the airway when you go to sleep. And so as a result, your brain you're breathing against this added resistance, and you're having to work harder. And so that extra effort arouses your brain briefly. Now, it may or may not be to the point that you're aware of it, but it keeps your brain in lighter sleep, creating almost a stuttering effect, so you're typically left feeling tired during the day. It can also lead to drops in your oxygen level, what's called your oxygen saturation, which can then result in a surge in epinephrine or stress hormone and such, and can promote things like high blood pressure, and is a risk factor for cardiovascular disease, stroke, cardiac arrhythmias, which I'll be talking about next month, things of that nature. So, I mean, cardiologists, if somebody's being seen for atrial fibrillation, will frequently send them to us to make sure they don't have sleep apnea as a trigger for their AFib. Some of the common other signs of snoring, now particularly what we call loud or what we call heroic snoring, can be an indicator that sleep apnea is present. So if it's a real, like the whole room or down the street, or you hear it, well, they probably need to get checked out. A large neck size, generally a neck size for men over 17, women over 16 is thought perhaps that's some risk factor. Certainly if somebody has excessive daytime sleepiness, I mean, that's the thing that usually drives people to see us, as well as spouses complaining of the snoring. I say spouses are some of our biggest referral sources. Night sweats, common symptom, morning headaches, dry mouth, memory, concentration problems, particularly short-term memory. I mean, it is common that folks in their 40s and 50s will come in and they'll think they're getting early dementia, and they have sleep apnea because they're short-term memory loss. Insomnia, and that can be trouble getting to sleep at night just because your sleep cycle is disrupted so much with sleep apnea, and you're maybe catnapping during the day, that it can consequently lead to insomnia at night. Obesity, I mean, particularly if the body mass index, I mean, is in 30 or above, I mean, that is certainly a risk factor. And then if somebody has hypertension, particularly if it's difficult to control, if they have diabetes or cardiovascular disease. In fact, I've seen an article where if you have the combination of diabetes and high blood pressure, there may be upwards of a 70% likelihood you have sleep apnea too. So we're all the time, diabetic doctors are sending us folks, and there have been some studies that suggest that controlling sleep apnea may improve glucose control to some degree. It may improve blood pressure control. So there are benefits to getting it looked at. So the impact mentioned, sleep apnea can affect overall mood and health, productivity, and certainly relationships and issues of safety on the road. The increased risk of hypertension, stroke, and cardiovascular disease. And overall, there's a 2 to 3-fold increase in overall all-cause mortality from severe sleep apnea. Now, they can't necessarily say the same for mild or moderate sleep apnea, but if it's severe, I mean, there's just a greater likelihood of mortality from any cause, I mean, just because it has such a pervasive effect. So how do we diagnose it? Well, many spouses diagnose it, and bring it to me on their phones, and have me watch the video there in the exam room. But to diagnose it to the point that insurance will pay for any treatment, we have to do a sleep study. Now, the traditional way to do that is with in the sleep lab, to where you'd be hooked up with all these monitors, you'd be allowed to go to sleep, have a technician assigned, they'd be looking at evidence of sleep apnea. If they do identify it, usually by halfway through the night, they would go ahead and try on a CPAP mask, which I'll mention here, adjust the pressure. Now, or it may mean coming back for a second night. Now, there are some home sleep testing devices that can be used in very routine garden variety cases. I mean, some insurances actually insist on that. There are some trade-offs in terms of how detailed information, but I mean, we can do them in the office. I mean, so we've certainly done a number of them, and they do have a role. And like I say, CPAP is usually started during the sleep study. Now, that is far and away the most commonly used treatment for mild, moderate, or severe sleep apnea. And basically, I mean, it can be life-changing for some folks. Now, you'll hear some people, there are negative stories about it, but with proper follow-up and care and troubleshooting the issues, most people will benefit and stay with it. Dental appliances are approved for treatment of mild to moderate sleep apnea. Surgery is really a last resort traditional surgery where you remove the uvula and part of the soft palate. Statistically, that only makes a difference 50% of the time, and it's usually not a cure. I mean, so it's extremely rare I've seen, surgery for sleep apnea completely cure it per se. Now, there's also what's called a mandibular advancement surgery where they actually, bring out the jaw, and that can have very good benefit in severe cases. Weight loss, certainly it can help. I mean, there is a role for stimulant medication helping people be more alert during the day, even with being treated for sleep apnea. Then there's a new device you may have heard of. There's been a lot of advertising called the Inspire device, and I'll mention that briefly here in a minute. But CPAP, basically what it does is it's mask going over the nose or inside the nostrils or over the nose and the mouth, and it provides a constant pressure that serves as a stent to keep the airway from collapsing. If you think of having a little balloon where you just give it enough air to give it shape to where it's not collapsing down, that's basically what CPAP is doing to the back of your throat and preventing the collapse that causes sleep apnea. Usually has a humidifier attached to the unit to minimize dryness, and it has to be worn during sleep to work, so it doesn't work just on its own sitting by the bed. There are several types of masks. The three traditional styles are the standard nasal mask, what's called the nasal pillows, and full face mask. There have been huge improvements over the last 15 years in the mask. I mean, and if somebody's going to have trouble with CPAP, it is usually finding the right mask. There are several brands, and it can just, sometimes the first few weeks, it can just be a matter of trying some different ones. So I tell people, say, don't give up, and after the first couple of nights, be patient with it the first 2 or 3 weeks and go with it. But it does have to be worn to be effective. Now, I would say, generally, 70% of folks will remain compliant with proper follow-up and dealing with any issues. And I would encourage people in general to wear it during naps if at all possible. Now, I'm sure you've all seen ads on this So Clean, and there are some other devices out there that are increasing, basically to do the kind of a disinfectant type process on the mask. I mean, because it can be hard for people to stay compliant with cleaning their mask and hose and such. I have people ask me about the So Clean all the time. I've had several get it, and I will say that the ones that have bought it have all been pleased with it. I haven't recommended it though, just because it's $300 and it seems like a lot of money to pay for basically substituting, soap and water and whatnot on a routine basis. I mean, it talks about how it disinfects and, and basically uses, ionization of the oxygen and whatnot. I'm not saying it doesn't have a role, and if it gets people focused on taking care of their mask and all, and it's worth it to pay that money, fine, because they've all actually been pleased with the ones that I've had buy it, but there's been a lot of press on that. There have been some travel CPAPs, a couple that particularly come out the last year. Now this lower one, the Z1, has been around for several years. I mean, it's kind of been the standard travel, and it literally is small to fit in the palm of your hand. It tends to be fairly loud from what I've read. I haven't actually tested one out myself. The two biggest makers of CPAPs, Respironics and ResMed, came out with their own versions of travel CPAPs this past year. The Respironics DreamStation Go and the ResMed Air Mini. seen both of those. I mean, they're slick. I think, they all have a role. The downside with the travel CPAPs is that insurance doesn't pay for them, and they can be fairly pricey. I'd say in general, I just checked this morning, this one, I've seen advertising, $400 or $500 range. I know that when these came out last year, I mean, this one, you get all the battery and all, I mean, it may be upwards of $1,000 or a little over. Now, if somebody that does a lot of traveling, it may be worth it to them. I mean, it comes in a hard shell case that you can check in your luggage rather than having to go through the TSA. But, the Air Mini, the question I have about that is whether it's not stable enough. I mean, I think you can clip it to the pajamas and all. It's not, this has more of a flat base. But they're cool things. I mean, I wish they weren't quite so pricey. I mean, that insurance would cover them. I think they'd be very popular, but they certainly have a place. Oral appliances, there are several out there, as I mentioned, and just give you, these are the two that I have tended to recommend for sleep apnea. They're more sophisticated. I've been told by patients, they have to get fitted by their dentist, and they may run $1,500-$1,600 if insurance doesn't cover them. Many insurances have become more provided better coverage in recent years. The Inspire device, just a quick word. There's a surgeon at UAB, Dr. Withrow, that is now implants these. It's basically a pacemaker device that's implanted to where it basically has a lead here that senses your breathing, and when you turn it on by this little control when you go to bed. And so basically it has a lead that stimulates the nerves at the base of the tongue to draw them up when you take in a breath to keep the tongue from falling back. It's basically indicated for moderate to severe sleep apnea that's unresponsive to CPAP. It's obviously more expensive than CPAP. Insurance has to approve it, and I know Blue Cross, I don't know if Blue Cross Alabama was approved yet. I've sent a couple patients over. Haven't had anybody actually get it yet. I've sent a few folks over to be evaluated. So a few words here real quick about sleep and aging. As we age, sleep does become more fragmented. That's just considered a normal part. I mean, more wakefulness. I mean, you may have arthritis pains. There may be several reasons for that. You also tend to have less proportional deep sleep, or what we call a stage 3 sleep, than you would when you're younger. But the overall total sleep time is roughly the same. I mean, so you may be in bed longer, and the sleep efficiency may be less in terms of the amount of time you're asleep relative to you're in bed, but the overall amount of sleep you require is about the same. As I mentioned, chronic pain can impact that. Medical conditions like heart failure, COPD, arthritis, medications like the antidepressants and beta blockers. Just general lack of exercise and inactivity, I mean, can impact sleep, and exercise is generally going to be helpful. And certainly loneliness, depression, anxiety, mood disorders, any number of things like that. So what can be done to help improve that? Well, exercising regularly. Just try to avoid vigorous exercise within a couple hours of bedtime if at all possible. Maintaining a healthy weight. Remaining engaged with others. Very important to establish and maintain good relations with other folks. Maintaining regular medical follow-up, obviously. Avoiding the alcohol, we talked about that. And then the sunlight issue, when you wake up in the morning, if you'll kind of open the blinds and get as much sunlight in when you first wake up, but in the evening hours, if you'll tend to just keep things a little more on the dim side. I mean, not to where you can't function, but just try to avoid the really bright lights in the evening. If you nap in the afternoon, keep it relatively brief. We talked about assessing your sleep environment. And you could certainly wearing one of those sleep masks to help minimize light. If somebody else in the house is up and you're trying to go to bed, just inexpensive sleep mask, as well as earplugs if someone's snoring there. And ways to minimize stress. I mean, there's a host of stuff online about yoga and music and all these sorts of, but a lot of things that can be done, obviously, to help reduce stress, avoiding smoking, and maintaining a regular sleep schedule. Just a couple quick words about sleep and technology here. I mean, this I think it's becoming, I mean, things with technology have just exploded so much in the last few years. I mean, it's like nobody has time to really see what's going on, but there's no question that it has had a huge impact on sleep continuity, particularly in the younger set, teens and college age kids and whatnot, because people, I mean, in that age particularly, and adults, older adults too, I mean, will tend to keep their device, and particularly if they're involved in social media, I mean, it is an all night long conversation. It's kind of this fear of not, being on top of things to the nanosecond, and they don't want to turn off their device. And consequently, it cuts in on the amount of sleep they have. They're tired during the day, can impact grades, school performance, all those sorts of things. And it's also suggested that it can be associated with stress, anxiety, sorts of, depression in teens and whatnot. So it's a big issue. The screens also emit shortwave blue light that is actually more potent in terms of affecting that body clock. So there are various blue light filters and things that I think they're available, or reading night mode on your screen to help minimize that. But that wavelength of light is particularly important there. Now, that being said, I mean, there are positive aspects, obviously, to technology, all sorts of areas, including sleep. And you'll see there are a whole bunch of sleep apps out there. I'll give you just a smattering of different ones in a second here. But basically, there are different ones that will, they'll tell you, they'll have some way of estimating how much sleep you have, and it's primarily by how much movement it has and what it's basically assuming you're asleep. So it's not real accurate. They're certainly not accurate enough that, a physician that we would rely on it for making medical treatment. But there is a role for them. I mean, and there are, I'm less impressed, I guess, the ones that try to estimate when you're in REM sleep or non-REM sleep. People come to me with all these fancy printouts, and I say, well, I don't really know what to do with it. But I think the big thing is that it gets people focused on their sleep. I mean, it's just kind of like getting them focused on exercise or weight loss or whatever. They're tuned into it and aware of it, and that's, I think, a big step. And there are several apps out there. I mean, Pillow, Sleep Tracker, Calm, Sleep Cycle, Relax Melody, Sleep Time, DigiPill, Ziz, Noisely, SleepBot, Sleep Better, Sleepo, Sleep Genius, and Sleep as Android, for starters. But so anyway, I haven't tried any of these apps. I have patients all the time show me these apps. Now, when somebody's, say, on a CPAP, they have cards in them that we get download reports and can really know precisely, at least how much they're using it and whatnot, and not necessarily their sleep amount per se. But anyway, they have a role. So basically, in summary, what's next for me? I would just say these just few bullet points. Make some effort to assess how much sleep you're getting and really try to get to that 7-hour mark. Practice good sleep hygiene practices, and you've got the list there. Just watching your caffeine and alcohol intake, exercising regularly, controlling your weight, managing technology wisely in the bedroom. And despite all that, if you're real sleepy during the day or have trouble getting to sleep, staying asleep, or you've been told you really bring down the roof snoring, consider getting a sleep specialist appointment. And remember, a well-spent day brings happy sleep. Well, thank you very much. It's a pleasure speaking with you.